Hey, what's up?
Yes, man. Yeah.
Good, good, good. All right, we are at China Medical Center right now, and I'm trying to do something that men do not do a lot, which is a checkup. And I brought my 61-year-old friend, Mr. Chipuma, today so we can experience this in real time. So we're going to do this for all you men that usually don't go for checkups. I know women do, yeah? Every time that you have women going for antenatal, all these things that are happening, but we never did. When's the last time you went for a checkup?
Yeah, well, it's a long time. I think I was younger than what I am now.
Obviously, you were younger than what you were yesterday.
Yeah. So, but I was younger then when I went for a certain checkup.
I go for checkups all the time, but I've never done this checkup. So this month, obviously, the month of November, is about cancer awareness for males especially, and prostate is one of the leading killers for men all across the world. And us, as young, handsome men, I as a young, handsome man, and this as an old, reasonably handsome man, are going to do a checkup for you so we can encourage you to do that. So have you ever heard about the procedure we're about to do?
Not really. That's why I want to take it and I want to try it and see and how it goes. That's why I've come here.
And I hope that after we try it, we'll be doing it like every week.
Yeah, really, because obviously we'll be all getting older all the time.
No, I'm not doing it every week. I'm doing it once, and that's all we're doing. So we're going to head inside. We're going to be talking to the doctor. He's going to let us know a few things. I know there are several exams for this, but the one we're doing today has to do with our backsides and something to do with fingers as well. Are you ready for that?
I'm ready. I'm
ready?
Yeah, very ready.
Did you sleep?
Yeah, I slept. No problem.
I didn't sleep.
Yeah, you didn't sleep.
I had bad dreams.
Yeah, but I think those people who do such a thing don't die, do they?
Yeah, they don't. So we're going to do that today. So let's walk into and do this today for everybody.
Yeah, exactly.
Good morning.
Good morning. How are you?
Fine, thank
Do
you.
you shake hands at the hospital?
Sure.
You do?
Thank you so much.
Mr. Kawit, yes, the
Good morning.
Good morning. How are you?
I'm fine. I'm all right. Thank you.
Okay.
Yeah. It's
Thank
just a simple thing.
No, nothing is ever a simple prick. Nothing.
Okay.
It's just a simple one.
The first one is your test. This one is a rapid, and then the control there. So if this one if it comes out, it means you are positive.
It means I've got some cancerous cells.
Yes.
Okay.
Prostate cancer.
Uh-oh.
So here you can see there are 3 lines which came out. This one for the test is there, and the second one the control. So which means you are carrying this antigen.
Morning, Mr. Steve.
Good morning, doctor. How are you?
I'm good. How are you today?
2 thumbs up.
Okay. What has brought you to us today?
Came for the prostate exam because a lot of people have been talking about it. So I just want to see what the issue really is, and just to find out what my body is, because us men have been accused of not checking ourselves. So as men, united men, we've come to check ourselves today.
Okay,
Yeah.
that's wonderful. Okay, Mr. Steve. How old are you now?
I'm 43.
43.
I'm an old man, just like you.
Okay, but you look young.
I know.
I was giving you this.
No, I don't know. The genes in my family, because even my father, he was like really, really young for a long time until one day he just became old. You know, I was like, eh? So that's what's going to happen to me. When I'm probably like 70, I'll just become old.
Wonderful. Let it be so for you.
Amen.
So any complaint these days?
No, no.
No complaint, just came for a checkup. So that's with Mr. Shikuma.
Yes.
Okay, sir. So how old are you now, sir? How old are you now?
I'm 61.
61.
Yes.
Okay. So as I was saying, I'll be attending to you. So I'll ask you some questions and then we'll continue with the examination. Later on I can decide on the diagnosis.
Okay.
So,
Thanks, sir.
so Mr. Chipuma, you said you are 61 years, okay? Have you been having any complaint these days? Complaint, something disturbing you?
Yeah, the complaints that, the thing that I feel like is like sometimes when I go to urine, I have difficulties sometimes to pass urine.
Okay.
And sometimes the urine just flows normally like that.
Okay.
Yes.
For how long have you been having this?
It's been quite some time. Because when I was a young boy, a long time ago, I used to have that. So, because I had an accident with a bicycle, but now it phased out, it went out. But as I grew older, as it started happening like that. So
you can, in terms of months of year, you can say how many years?
I think later in my 40s, I think that's when
40s.
I started experiencing such kind of problem. Yeah.
You suffer from any disease like sugar, BP?
BPS, 2 years ago, that's when they discovered that I had BP. With sugar, no, I haven't tested yet with sugar, as far as I know.
How about the nights? Do you urinate frequently in the night?
In the night, yes. I especially when I drink a lot of water, but sometimes I could just urinate about 3 times.
All right.
In a night?
Yeah. Or 2 or 3 times thereby.
You never get any sleep, do you? You don't sleep 3 times.
Okay.
I see.
So I think for now what we'll do the physical examination. I'll have to examine you, especially for the symptoms that you are having. The pain when urinating, the reduction of the flow of the urine, and also urinating in the night. So I'll have to examine you because looking at your age, it is possible also to have a problem with the prostate. Okay, we won't say that is because when people are talking about prostate, people are scared, just cancer. No?
It's cancer in front of you.
So most of the people they think about it, but these symptoms are not specific for cancer, no. So what we'll do right now, we'll do some tests. The first test we'll do, it is called PSA, prostate specific antigen. So the blood will be collected and the blood will be sent in the lab. And from here, we'll do the digital rectal examination. I'll have to examine the prostate to see how it is. Is it enlarged? Is there any abnormality? I'll check it from there. But just to assure you, with the PSA, it can, because there is what we do, the rapid test. When we do the rapid test, it can be positive. But if it is positive, it does not mean that the person has got cancer. No, it just means that the PSA is increased. We have to check the prostate. It can be an infection. An infection of the prostate can lead to increased PSA. It can be what we call a BPH. So the benign prostate hypertrophy. So the
benign means it's not cancerous.
It's not cancerous. It's just the volume is increased. It can also lead to increase of PSA. Cancer as well also can lead to that. So
there are 2 ways.
Yeah, and also the PSA is influenced by many things. For example, a person who's riding a bicycle 2 days ago, if you do the PSA, it will be high. But you cannot say that this is just. You cannot say that. Or a person who had sex before, after ejaculation, the PSA can go high. So you cannot just say, okay, this is cancer or whatever. No. So what we do is we do the rapid test, it's positive. We'll do also the blood test. We'll send to have the result, I think maybe in some hours. And we'll also do the examination. From the examination, it can help us to have an idea on what is happening. And also, even after doing that, we can still do other tests like biopsy to make sure that it is it. Those suffer from any disease that you know, like BP, diabetes,
No.
asthma.
No.
Have you ever suffered from TB?
No.
No. Have you ever checked for HIV?
Yes.
Okay. Have you been operated before?
No.
Are you allergic to any food or any medicine?
No.
No. Okay. Are you married?
No.
Not married.
Yeah.
Okay. How many children do you have?
4.
4 children.
Yeah.
Do you smoke
Used to. My last cigarette was on the 1st of January this year.
this year? So you have stopped completely?
Yeah, this is my 11th month.
Okay, wonderful.
Yeah.
How many sticks were you smoking per day?
5. I wasn't that type of smoker. Just 5 cigarettes a day. Only at the weekend when you go for drinks, that's when you outsmoke maybe a packet the whole night. But during the week when I'm working, 5 cigarettes.
Okay, wonderful. How about alcohol? Do you take alcohol?
Yes, I do.
How often do you take?
Today is Friday,
Yes.
tomorrow is Saturday, and the morning of Sunday.
So for the
3 days.
how many bottles do you drink?
Above 10.
Above 10. You get drunk, or after taking 10 you get drunk?
Yeah, I start dancing.
Okay.
Yeah.
But dancing, is it getting drunk?
Yeah, no, you dance, then you go home.
Okay.
You be not drunk. What's tipsy? Tipsy and happy.
Okay.
The one they say in the Bible. Drink and be merry, but don't be drunk and you're a Christian.
Married.
Don't be drunk and get married. Okay, that's what they say in the Bible.
Okay. Let me just proceed.
Okay.
Okay. Are you having any headache? Any other symptoms?
No.
Any coughing? Just.
I've had a cough. I'm developing cough recently, but it hasn't come out.
So right now there's no cough.
No cough.
And how's the appetite?
Appetite the past few days has been bad, only because of stress, I think.
Okay. How
Yeah.
about now?
I don't know. I haven't eaten anything. I've had a sandwich today,
Okay.
but I haven't. I usually have a high appetite, but the last 2 weeks, my appetite has been terrible.
Okay. Have you been vomiting?
No,
Or having diarrhea?
no. But I poop a lot though.
Or it's not diarrhea?
No, I do it like 3 times a day, like from the time I was a child.
Up to today.
Sometimes now it's even 4, I think. Hi.
I don't know. I don't live with you.
Does he know about it?
We talk about a lot of things with this man.
Okay. But how is it when you're urinating? Is it paining, itching?
No,
No.
it's just fwa.
No difficulty in urinating?
No, just full, just good.
The flow is just normal, not
It's-
reduced.
It's a good time.
Wonderful. Have you been experiencing body hotness these days?
Body what?
Hotness?
No.
Fever? No.
No.
Alright. So, as you came for the checkup, what I'll do from now, we'll just do the examination as well. So, as I said, the PSA was done, that was negative. So, but now the next step, we'll send blood also to the lab to do also the PSA.
Okay.
But meanwhile, I will have to examine you. Because when we are talking about the prostate cancer or the BPH, the advice is to start the screening when you have 50 years. Some they say 45, sometimes even 40. So that's the right time for us to check to see if there is something wrong.
So what is it exactly that you do?
So
The same thing that we're about to do now. What's the procedure like?
yes, from now the physical examination that I will do it is called a digital rectal examination. So I'll use my glove, I'll put some lubricants. So I'll introduce my finger in there until I reach the rectum, and I'll try to examine the prostate, which is a gland.
You have long fingers. Very long. Yeah, long fingers. We're
But
in
it's
trouble.
we'll be gentle, it's not a...
They don't have shorter people with shorter fingers at this place.
They are there, myself.
These are the shortest speakers. Okay, cool. Yeah. So how long are you in there for?
So 5 seconds to 10 seconds.
Okay. And you're moving around.
Yes.
Okay.
Moving will be examining just to see, to feel the consistency of the prostate. How is it looking like? It's not painful. It's not painful because I know many people they don't like it because they think it's painful. It is not painful, and it does not take long. Just some seconds and done.
Okay, I got another question. I know this might be a bit unconventional, but so people say that there's also a sexual aspect to this. Like people get sexually aroused when this is happening. Is that true?
Not really. It's not true.
Because that would be embarrassing for you. For you.
Because as you have, it's an examination, right?
Yeah.
It's your mind is about your mindset. Your mindset is not in sexual things. No, it's just.
So it's a myth what people have been saying that there's something in there that automatically just says happy things.
Yeah, because I know that men they believe in a lot of things, but there's nothing like that.
Oh,
just
okay.
down, we do it for some seconds, and you are done.
Okay.
Yeah. So I'll ask you to go on the side, then we'll have our examination. So I will examine you.
Okay. Yeah, good. I'm okay. Oh God.
Gentle. No.
That's better. Wow.
All right, I'm done.
Huh? Took your time.
So, Mr. Steve, I've done the examination.
All right.
So the findings are showing that your prostate is okay. So it is not enlarged, so there is nothing to worry for now.
Okay.
So, but we need you, as you always say, prevention is better than cure. So what you can do from now, it is prevention, because you don't have that abnormalities that we're checking. So prevention, it comes about it's from food, what you eat.
Like what?
So you need to be eating well, especially fruits and vegetables, because
Okay.
there are a lot of benefit from vegetables and fruits. There are some vitamins like vitamin C, E, and A that you find in fruits that is very important and can prevent those cancers of the prostate.
Okay.
So for now, the advice also be you need to be checked every 2 years, 3 years. You can still come and be checking to see if there is any change. But it's not a must that every man should have it. No, it's not a must. Some men can have it, others they don't have it. The matter is just the risk factors, because there are some risk factors. The first one is age. Above 50 is a risk factor. Also, we have obesity, it's also a risk factor. And also, if in the family you had someone who had prostate cancer, it's also a risk factor. So for now, I think that's our advice for you. So you did well to come, though it is normal, but you did well to come.
Hey.
Wonderful.
We just wrapped up our examination. I've gotten my results, he's gotten his results. These are things that we all need to be doing as men, checking what's happening. And this month of November, tune into Luna Lifestyle TV and see all this content where you can actually be a more aware man. Do you feel more aware today?
Yeah, I mean, that's the right way to go. And this done, and even any other man should come along and then do their test of prostate cancer. It's really very good because it helps you to continue with the health.